Dr. Amrita, can you please
Yeah.
introduce the case?
Yes.
Can
So next up we have with us Dr. Rajesh Sinha, who's Professor of Ophthalmology in RP Center, All India Institute of Medical Sciences, Delhi. Today we have with him the patient who is a 66-year male being operated for left eye cataract surgery with NS2 cortical PSC, the prominent brow and deep set eyes. The IOL to be implanted is 18 diopters. Over to OT number 1 to start the case for Sir, please.
So Dr.
Okay.
Rajesh has been very concentrated. He's already completed the rexes of the patient, and he's now ahead with
so
the hydrodissection.
Okay. So
so
can
thank
you
you,
hear me?
Rajesh, for doing the
Yeah.
Rexes
I
before.
know. Ma'am, that you will definitely thank me for that. And so this is the golden ring that I could create with the hydro. The nucleus is rotating well, and I will start with my IP40, vacuum make it 400. अरे हाँ ये ठीक है 300 sorry 400 400 yeah, and that is 30. Okay, so this is a 66-year-old. Can I have the chopper, please? So this is a 66-year-old male, and a very deep set eye, so you can see sometimes because of collection of fluid the visibility may be difficult. Can you just hold his head? इसको सिर पकड़ लेंगे ऐसे. हाँ. So 66-year-old male, but considering his age, his nucleus doesn't appear to be very hard. Well, the appearance initially gave this impression that it is not hard, but it is leathery kind of. But yes, after dividing on one side, I could chop it well after weakening on one side. Then I'll rotate it. Then again impel and chop again.
Dr. Rajesh, Dr. Amit here. You usually do primary chop only or?
Yes.
Okay.
Dr. Amit, good afternoon. I saw your deferred live and it was fantastic. So
thank you, sir.
And so I've just divided the nucleus into 6 pieces. Can I have the IP on, please? IP on हो जाएगा?
So IP actually gives you a better followability always. So when you've made those pieces and you have to actually actually emulsify them, then the followability with the IP is always good.
So once it has been divided into multiple 6 pieces, you can start the intelligent phaco. Now, before making pieces, it is advisable, you can, but it is do with IP, but it is advisable not to start intelligent phaco, that is longitudinal as well, because the fold will not be that great. But once you have divided it into multiple pieces, you can go ahead and use IP and finish it off. And this is the EP nuclear plate which has come up nicely. And now, Babaji, सीधा रखो please. बस. Yeah. Now आइए, coaxial. So as in the morning I could see Dr. Namta, can I have the methylcellulose? So I'll just put little bit of methyl cellulose in the anterior chamber. This is the only time when I put little bit of methyl cellulose because the chamber was becoming a little on the shallower side. We don't want a shallow chamber anytime. कोएक्सियल नहीं है, कोएक्सियल नहीं है, अच्छा कोएक्सियल नहीं है तो आप ऐसा करो मुझे एक वो ब्लेड दे दो, एमवीआर दे दो, एमवीआर दे दो, कर लूंगा मैं उससे कर लूंगा, एमवीआर दे दो, एक और ओपनिंग बना दूंगा. आई हैव जस्ट मेड वन साइड पोर्ट, सो कैन आई हैव द स्वैब स्टिक प्लीज. एक हाँ, I just made one side port as you can see here. Now I'll make another side port because they have the bimanual irrigation aspiration here. Coaxial, I think he is looking for coaxial, but sorry. अच्छा, अब हो गया मेल फीमेल. ये ले लीजिए. Just hold this. So, as I was hearing Dr. Namrata, we all, I myself, along with her, we are more used to using coaxial, and in our hands, it provides a faster particle aspiration if we use coaxial. But yes, we should be using all sorts of instruments, so I can use bimanual as well, and sometimes you do have to use bimanual. And so the cortical aspiration with bimanual, particularly subincisional, is easier. Now, the only thing is that you have to spend some more time with it, and particularly if you have something like this, a small epinuclear piece, it will take a little bit more time to come in. The second thing is that sometimes you can manage to remove the fiber from the same port, from the same side, but sometimes you will have to change your hand. I'm just trying to polish the capsule. What I feel is that if I change the hand, it will help me more in removing the adherent particle fibers on this side.
If they don't come, we will not hold the. So Rajesh, you would agree with me that bimanual is slower than coaxial.
No, I completely agree with you, ma'am. I have never disagreed on any occasion, actually. But yes, on this occasion, I will 100% agree. And it does take a little bit extra time. But I guess maybe people who are more used to who are more used to bimanual, they may be a little bit faster than what we can do. There is a very small plaque here which I'm trying to polish, but it's not coming. So we'll just see in the post-op period how it behaves, and then maybe we'll have to do, if the visual acuity is not great, then we'll have to do a YAG for this small plaque, because in spite of rubbing, can I have the irrigation ka? I'll just try to push some fluid from the side port. Can I have the lens, please? Lens खोल देंगे? हाँ, मैं करूँगा ना, मैं करूँगा. I'll do it. I'm just trying to do it, but this is, you can see here, this is a pacified thing. This is also a pacified thing. So it will not come with whatever you do. So can I have Hilon, please? Yeah. So I'll just put Hilon, and then I will load the lens. इधर रखिए बाबा जी. हाँ, बस. हाँ. This is the Biotech acryl cert lens, and I'll just show you how it is loaded. एक minute. So this is the, I just try to, yeah. Okay, is it focused? Is it?
Yeah,
Saline.
it
We
is
can
focused.
see it.
Yeah,
It is focused.
Saline. So first you have to put, these are the two wings, no? So you have to put some saline below the wing. Put some saline here. And you also put some saline from the tip. And then you press this one, this small plunger. So as you press, the lens first haptic gets a little folded and it becomes fixed. Now, methyl cellulose. Then you have to put methyl cellulose underneath this, underneath both. And once you have put the methyl cellulose, then you close the wings. And once you have closed the wings, then you press this one so that the lens comes anteriorly. And now you just have to rotate this thing after you have put the lens in the eye. So, wait. After you have put the tip of the cartridge into the eye, actually. So, I am going through a 2.2 millimeter incision, which we can. I do inject all my biotech lenses through 2.2 millimeter incision only. बाबा जी सिर को सीधा रखिए बस 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 and then I'll dial it and put it behind like this and आइए अच्छा ये दे दो हाँ यही है ना bimanual ना and now with the help of a bimanual I'll remove the remaining viscoelastic and this is a specially designed lens which has a asymmetric, zonal asymmetric power distribution, and it has a good intermediate distance, a defocus of 1.75 diopter in comparison to a monofocal lens which has a defocus of 0.5 and any other like some other lens like iHands which has a defocus of 1.5 and the best place to keep the position of the haptic is superinasal and inferotemporal. So this is what I am going to do and
So I think, Rajesh, that was an excellent surgery that you demonstrated wonderfully, and also showed the steps of loading.
Behind the IOL.
And this is the double compartment technique of viscoelastic aspiration, where you go behind the IOL and in front of the IOL.
Yeah. This lens has a good intermediate defocus curve of 1.75. So the distance from distance to 57 centimeter the patient can see, and that is a reasonably good acceptable intermediate vision. And with a bilateral implantation you can have something like N8 or when you have bilateral implantation.
So thank you, Rajesh. I think we'll move to the next case. Dr. Virender, are you ready? Thank you, Rajesh, for a brilliant surgery. Brilliant surgery.
मेरा माइक ऑन करना बोलना या उनको बोल दो ही इज रेडी. नहीं वो डॉक्टर नमता पूछ रही ना, आर यू रेडी?
So Virender, can we?
माइक चालू कराओ.
Mic चालू है Virender. We can hear you.
हेलो डॉक्टर नमता, कैन
We can hear you. We can hear you.
या थैंक यू.